Hi, my name is John Raymond Smith, and this is a presentation for the sports injury prevention at ACU. Now, the reason for this study, there's a greater number of female athletes suffering anterior cruciate injuries relative to males. There's also an increased number of females entering high-risk sport these days. So what this study hypothesizes is on the possible mechanisms leading to ACL injuries in females. There has been a dramatic increase in females entering sport in the USA these days. That's roughly doubling in the last 10 years from 0.3 million to 2.8 million. There has always been a large number of males playing sport, so the increase is much less, from 3.7 million to 3.8 million. That's only 3% increase. Now, female athletes who participate in high-risk sports suffer 4 to 6 times the amount of ACL injuries relative to their male counterparts playing the same sport. That's an estimated 38,000 ACL injuries occurring annually in women's sport in the USA. The cost is quite high, both physically, mentally, and per dollar value, of course. An estimated cost per injury is $17,000 individually, and the cost of surgery and rehab for ACL injuries is approximately $646 million per year. Now, when we look at injury mechanisms, we know that high knee loads occur in both genders that play the same sport. Most of these injuries are usually non-contact and occur during sort of normal movements through sport, which is deceleration, sudden change of direction, pivoting, and landing tasks. So why these tasks result in great incidence of ACL injuries in females up to this point has remained unclear.
Oh no, I fucked it up.
Now, when we look at the etiology, a large number of studies of ACL injury risk factors are focused on anthropometric anatomical measures such as thigh length, height, femoral notch width. Although these factors might contribute to ACL injury, they're in essence not modifiable. Hormonal factors, particularly those linked to sort of hormonal changes during the female cycle, looking at hormones such as estrogen, progesterone, and relaxin, have been shown in some studies to affect ligament structure and laxity. Modifiable factors have a potential for intervention. There's increasing evidence in the literature suggesting that poor neuromuscular control of the lower limb mechanics, and specifically the knee, during the execution of sort of sporting movements is a factor. And forces such as landing, twisting, and factors that sort of have poor muscular control may be affected during sport. There's increasing evidence that poor neuromuscular control contributes to ACL injuries in females. Now, to control the forces around the knee joint, we need two things. We need ligamentous restraint. We need also muscle control, leading to stiffness and dynamic stability. There has been a few neuromuscular training studies prior to this to try to sort of prevent ACL injuries. A study a little while ago of male soccer players, for example, showed significant effects of balance board training. Also, technique-oriented training has been known to help as well, such as landing techniques, strength training, and techniques that sort of stop too much adduction underneath. So the question was asked, is neuromuscular control directly linked to ACL injury? Could a more effective screening regimen be implemented to identify athletes at risk? And could this lead to more effective neuromuscular training regimes to reduce sports-related ACL injuries in females? For this study, they used 205 female adolescent athletes in high-risk sport such as soccer, basketball, and volleyball over 2 seasons. These were measured for neuromuscular control using 3D kinematics and joint loads using joint movement and jump loading task. Measurements we're using were analysis of variance and regression to isolate predictors of risk. For the study, the subjects had to jump all the way up a 31 centimeter box onto some force plates. As soon as they landed, they were asked to jump as high as they can, throwing the arms up in the air. This was done 3 times. The force plates had collected ground reaction forces, and this was synchronized, of course, with the motion analysis data. As shown on diagrams, external marker locations were used to generate lower limb 3D joint kinematics and kinetic data. Dynamic valgus shown in this diagram by the hip joint itself going to adduction and the knee going to abduction. Also, you can see what's happening at the ankle at the same time. This diagram depicts the kinematics during the vertical jump. We can look at the uninjured on the top row and the ACL injured in the bottom row. At initial contact, this change again, just a slight change there in abduction, increase from the uninjured, and we can see at peak contact that there's an increase in abduction again. Looking at from the sagittal plane there, we can also see that the injured players, they had less knee flexion. The diagram on the left shows the mean standard deviation during abduction of the hip and adduction moment while landing. The second diagram on the right demonstrates the ground reaction forces that have increased by 20% in the injured cohort. To conclude, 205 female athletes were prospectively screened by a 3D biomechanical analysis before the season. 9 ACL injuries occurred, 7 during the soccer play and 2 during basketball. Knee abduction angle at landing was 8 degrees greater than ACL injured. The ACL injured cohort had 2.5 greater times abduction moment with 20% higher ground reaction forces and 16% shorter stance time. Hence, the increased motion force and moments occurred more quickly. Knee abduction moments and dynamic valgus are predictors of ACL injury. The increased knee abduction motion in females before ACL injuries suggests decrease in neuromuscular control of the lower extremity. Probably reflects these differences in contraction patterns or inefficient neuromuscular adaptations. This could be in the adductor of the hip, the knee, and the high demands of the sport. Muscular forces are very important. They can decrease the dynamic valgus around the knee there. The reduction of these forces will increase ligamentous loading, but co-activation of these muscles is protective and activated 40 to 80% before it touches the ground. Now, when we look at hamstrings, studies have shown that the hamstrings are quite often weaker in females. This is a problem in some cases, as decrease in hamstring activation may lead to weak quadricep activation, therefore poor control at the knee. Neuromuscular training may result in safer planned movements, patterns, and knee stability, with decrease in valgus loading, ground reaction forces, and strong potential for success in training. To summarize the study, females are at greater risk of ACL injuries compared to males. Increased valgus motion and valgus moments the knee during impact phase of jump landing are key predictors of potential ACL injuries in females. Neuromuscular training has the potential to decrease ACL injuries in female athletes. Thank you.